Um, Good morning, everyone, and welcome to IIMChat. It's a beautiful Sunday morning here in Singapore. I hope it's the same in Bangalore, Chennai, Chandigarh, New Delhi, other places where people are dialing in from. And wherever you are, I hope you're staying safe, sane, and healthy. Virtual meetings require some different ground rules. So before we kick off here, I go with a few of them. First, it's a webinar, which means the panelists will be on video and audio, but the rest of the participants are only able to interact with the Q&A button. You will see it at the bottom of your Zoom screen. So please use the Q&A button to ask your questions. And as the moderator, I will make sure that the panelists are able to look at that and address as many of them as possible. The second one, and this is important, remember that all of us are doing this from our homes. Our panelists' spouses, their children, their parents, their dogs, other menagerie have probably more right to be in their houses than 200 strangers. So they may make a guest appearance, and when that happens, let us embrace that unexpected development. Technical glitches will happen, and they are to be expected, but let's focus instead on the minor miracle that brings nearly 200 people together on a Sunday morning on a channel called Zoom, which is a technology that most of us had never heard of a month ago. And finally, we'd love your feedback. So at the end of this, let us know how it goes. Write in to us at secretary@iimpact.org. That's secretary@iimpact.org, or take the poll. It'll be a short one that will take you no more than 10 seconds. So having dispensed with those, let me move on to the main event now. The motto of IIMPACT has always been ideas meet alumni. To achieve this objective, we've typically met in large format events like IIMPACT and intimate ones like IIMChat. Both are held in real world time and space. In the age of lockdown, or as we call it here in Singapore, circuit breaker, we decided to transcend the limitations of space and take IIMChat virtual. And by spreading this through social channels after, we also hope to transcend the limitation of time. And what better way to start the first virtual IIMPACT than to address the issue of our times, COVID-19. But this is a session that I promise you will be one with a difference. It is not a debate on policy or on politics. It is not about different opinions masquerading as facts, alternate or real. It is a story of inspiration. It is a story of action, of people who got off WhatsApp. So if you're on WhatsApp right now, you should be getting off WhatsApp. People who got off WhatsApp and ventured into the real world. People who chose to work for those who are in real need. Of the energy of entrepreneurs meeting the experience of the government and civil servants. Of businessmen and bureaucrats working together. And what's fantastic is that today, everybody we feature here is an IIM alumnus. So the next time you are about to send that WhatsApp forward or make a comment, just remember these people, they chose to walk a different path while most of us talked away. So without further ado, I present Inspiration in Difficult Times, stories from the front line of the war against COVID. We feature two inspiring stories today, Defeat COVID and FeedMyCity. I'm Suresh Shankar. I'm a tech entrepreneur and Deputy President of the Pan IIM Alumni Association. I'm joined today, and I'm going to introduce my panelists one by one. Vinny Mahajan, Additional Chief Secretary of the Government of Punjab, a distinguished alumna of IIM Calcutta. Venki Krishnamurthy, tech entrepreneur and from the IMC class of 1994. He leads Defeat COVID. K. Ganesh, serial entrepreneur, founder of Growth Story, IMC class of 1985, and the leader of the FeedMyCity movement. J. Balaraman, IMC class of 1985, tech entrepreneur, CEO of Congruent Solutions, and president of the IIM Calcutta Chennai alumnus. We also have with us Sanjeev Iyer, president of the IIM Alumni Association. You're very familiar with Sanjeev, who's been our leader for many years. And we have Ramraj, director of the IIM Calcutta board. And we will shortly be joined by Sri Jawed Ashraf, High Commissioner of India to Singapore. So without further ado, let me go into the first story, and I'm going to really start off with the Defeat COVID story, and I'm going to request Winnie and Venkat to stay on the video and the other panelists to go off while we kind of get to that. So if I may, let me start with Winnie. Winnie, have you're sitting in Chandigarh, have you had much sleep these last few weeks and months? How is the situation in Punjab? Is it under some level of control?
Thank you for that. So no, I think we all understand this is a marathon, not a sprint. So lack of sleep is not a good idea. Having said that, I think the number of times that you have thoughts running through your head is not to be dismissed lightly either. In Punjab, we went through pretty much the same story as the rest of India. It hit us suddenly. Nobody actually knew what this all was about, but we had the advantage of other countries having already gone through some things. Early lockdown in Punjab, we actually went through a curfew. So the chief minister decided that we were not going to take a chance. We have a large NRI population that had already come back home before the flights were cancelled and all of that. So we went through the usual stuff. I was pulled back into the health sector. I had been health secretary for 5 years, but now industry secretary. And I was brought back as chair of the health sector response and procurement committee. So all the way from how are we able to test, how much do we need to test, to what kind of hospitals we need, how many ventilators, how many isolation facilities, the whole thing. The good news is that we haven't done too badly. India as a whole hasn't done too badly. Punjab, we are 14th amongst all major states. There are only 8 major states that have fewer cases than us, which is not bad, but it still bothers us that we have 17 deaths. It still bothers us that we need to ramp up facilities very quickly. This period of curfew / lockdown is a window that we are desperately trying to use to ramp up every which way. So long answer to your question, Suresh, but these are difficult times, but it's amazing how much effort people are putting in, and especially our young field officers, each one of them. You know, there are stories of people having just had a baby and not even seeing the baby back to work. Not the mother, the father, but even the mothers with little babies going back to work and so on, newborns. So lots of good stuff is happening, not just in the government.
Thanks. Vinny, I think you mentioned, I think 2-3 things are coming around the world, right? Testing, the availability of testing equipment, availability of PPE. And I know that you've been working with the private sector on both of these. And could you tell us a little bit about the kind of challenges in getting testing? Everyone says test, but it's obviously not easy. I know you have some interesting stories about how you've been doing your testing and how many things you've had to pull. So anything that you could share us about testing and the availability of PPE and how you're ensuring that?
Yeah, so on testing, there's been so much on this. I'm sure everybody is reading everything. And we all know by now that there is the viral load testing, which is done through RT-PCR in the laboratory. And then there is the rapid testing. And rapid testing is a controversial story. It's a problematic story. Viral load testing is actually the way of testing whether there is the virus in the sample or not, in the body or not. And we all know this is a new virus. So there actually wasn't any testing facility in the state and most other places, obviously, until this broke out. So early March, we were on a zero. We had our viral testing labs at Amrit in the 2 government medical colleges. They were quickly ramped up with required equipment and the testing kits. We started doing some 40 tests a day. That was the situation exactly a month ago, 26th of March. And then we decided that we had to work with the private sector. So our advisor, medical education and health, Dr. Talwar, a renowned cardiologist and big support to the state, he got in touch with the leading private medical college in the state, the DMC at Ludhiana. And they needed some upgraded equipment. So he talked them into going for that. And let me give you the date. So 26th of March, he reaches out and says, I'm talking to DMC and I'm asking them to upgrade equipment, but they will need help because apparently to be permitted to do viral load testing in India, you have to have NABL accreditation, which is like, ooh, that's it's almost impossible. Pretty much. And you need ICMR clearance. So we said, okay, let's try. So while he pushed them into getting the equipment, I quickly Google searched who regulates, who controls NABL, how can we reach out to them to fast track this? Because otherwise 6 months easily out of the way. So I found NABL Quality Council of India, QCI. So which ministry? So QCI and it search. it's the DPIIT, the Industry Ministry in the Government of India. So a call to Secretary DPIIT, Sir DMC, he says, is it government? I said, no, but it's the best private. The best med students go there from Punjab. So, okay, let me talk to them. So that route, then we got the application in finally, 31st March, there are problems in the application, complexities. 1st April, application goes through. 8th April, secretary calls me and says, they've cleared it. And this included, by the way, an inspection, physical inspection that needed to be done, which was delegated to PGI. So their team came from Chandigarh to Ludhiana. Then they needed some kits because you need to validate your processes. You need to calibrate them. They don't have kits. So Government Medical College Patiala, thou shalt give kits. Government will give kits to private sector without charging. Don't get into all that just now. And then ICMR. 14th April, we were told, all right, ICMR has also cleared it. By 18th April, they had received all clearances, including from the state government. The rates had been fixed. They had received their kits and they were ready to roll. So DMC became the first private testing lab in Punjab. And this is what is so hopeful. This was the state government, the government of India, autonomous scientific institutions that actually otherwise are so tough on all this, but recognizing the need and responding to what they saw was important, but also doable. It happened.
And you had a similar one on the ventilators and how you had to work with airlines, people in the south of India, whatever it is. So, about how you actually had to make sure the ventilators
so that's another favorite. That's my PPE story. So again, when we got into this, we realized that all over the world, you've all heard about this, the personal protection equipment, the hazmat suits, the N95 masks, those were suddenly in short supply all over, and we were shocked. In a casual remark, the chief secretary said, but our textile industry can make this. This is nothing. And I'm like, okay, yes, Punjab has a very strong textile industry. So we reached out to them. Guys, anyone doing this? No. Do you know how to do it? No. Okay. So then we put out the word. And again, this is like the month of March. Do check out. Can't you do it? I'm sure you can. And then again, exactly a month ago, 26 March, I get a call from the Secretary Textiles Government of India. Ravi is on the line saying, JCT has reached out to us. Apparently, they used to, in the Ebola time, do some hazmat suits that they sent out. They still have some samples. They don't have they may or may not have the certification. Can you talk to them? So a call, Priya Thapar is the person who's leading this effort. So Priya, do you have hazmat suits? Yes. Do you have a valid European certification? Because that can work. Let me check, ma'am. Checked, sorry, it's expired. So then what? So then back to Delhi. The central testing lab is in Coimbatore, Citra. How do we reach it there? This is 26th March. It's the height of the lockdown. Delhi is not allowing any movement. Haryana is not allowing any movement. There are no flights. There are no trains, no buses, no cars, no nothing. But they have a suit ready and she's confident. Ma'am, my suit will pass the test. But how do you get it to Coimbatore? So Cabinet Secretariat, the Additional Secretary, Giridhar, how do we get this? I am asking this nodal person in the Ministry of Civil Aviation to arrange a special flight from Delhi. But can you reach that sample to Delhi? So then I use some personal influence. The DGP Punjab happens to be husband. It helped. So then we need a police vehicle collecting this bodysuit from Phagwara, JCT Phagwara. And we want this police vehicle taking it up to the Delhi airport where they will hand over. Yes, of course. So by night of that day, the sample had been finalized, sealed, the vehicle had left for Delhi. Delhi airport, then there's a WhatsApp group. So don't get off WhatsApps, it's very useful. A bodysuit WhatsApp group still lying in my phone between the civil aviation, between the SpiceJet person, between the person at the airport terminal who's going to give the clearance to this flight to take off, and between the police inspector who's leading this party. And all night, this conversation's going on. By the way, I slept most of the night, so I just saw most of it in the morning. The team reached, the flight took off with some hiccups. reached Coimbatore, offloaded, went straight from from the airport to the lab. The lab tested it, cleared. It's good to go. It's good to go. And then JCT, how quickly can you ramp up? Ma'am, we need curfew passes. Yes, DC Kapurthala give all the curfew passes they need. We need this raw material. We need these tie-ups. We need some suppliers in Ludhiana. Yes, yes, yes to everything. Don't worry, that's our problem. You'll get everything. They got everything. They started making it. And do you know what? They weren't the only ones. Then we had the confidence again to reach out to our textile industry and say, Ludhiana guys, JCT is done it. What are you up to? And you know what? Last night, I get a WhatsApp message from my director industries, who's actually built this group with all the textile people wanting to do it. Each of them has got their samples ready, taken it for testing to Citra. Citra's got overloaded. Then we go back to Delhi. That lab is overloaded. They've got a DRDO lab then working at it. So, okay, you can send your samples to DRDO. Last night, our 19th PPE manufacturer has been approved. So today, Punjab has 19 approved manufacturers of hazmat suits supplying to HLL for all India requirements, and we've given other orders as well, starting from zero. We have 4 manufacturers of N95 masks starting from zero, starting from when we didn't even know what this was. And this is industry responding so enthusiastically. I mean, the first time we talked N95 masks, this guy said, ma'am, I can do it. This guy's sitting somewhere in Hoshiarpur. It's not even the textile center of the state, but he says, I can do it. I just need the fiber. So N95 masks need a fiber. That fiber is not available. So back to Delhi, where is this fiber available? So they say, this is Gansura, another place. End of story.
So Vinny, it seems that you are actually using your WhatsApp for good, and I'm going to come back to that in a moment because most of us are using it for sending forwards. But I'd like to welcome Sri Jawed Ashraf, High Commissioner of India to Singapore. Jawed, thanks for joining. We're doing the first version of this, and we'll kind of bring you back in at the end. I think we're just going through Vinny and the Punjab story right now. So I think I'm going to shift to Venki, who's the other part of the story. Venki, you're from IIM 1994 batch. What made you get into this whole thing about, defeat COVID? What made you start it?
So it was, frustration with WhatsApp, like you were saying, right? We had just met for our 25th year reunion and had a great time, great camaraderie, and the WhatsApp conversation continued. But there is just about everything we talk about and solve in WhatsApp, like macroeconomic issues, societal issues, matters of policy. We have an opinion on everything. But it really doesn't go beyond that into anything that makes an impact. So when this whole COVID thing came about, a few of us are China watchers. We knew this was kind of coming to India in one sense. So we started talking. So it's 5 of us actually. So me, Srinath, who's an AI entrepreneur based out of Chennai. I'm also based out of Chennai. Sanjay Singh is based out of Singapore. He is the regional CIO for 105 countries in Asia Pacific, Middle East, and Africa. So he jumped in, and Rajesh Jindal, who's a marketeer who kind of heads marketing for UiPath, which is a very fast-growing company. And later, Sameer Chawla, who recent stressed assets, joined us from Mumbai. So it's between Chennai, Singapore, Mumbai, and Delhi, this team. We started talking, and we said, what can we do, right? We didn't have an organization. We didn't have any experience working with the government. But we were good in technology, broadly, most of us, and we were good in relationships and networking, right? So that was the basis. So we came up with a core idea. The initial desire was to go beyond just WhatsApp and do something. And there was also this theme of we're all getting to be around 50. What are we going to do with our careers, right? Is there an alternate path? Is there something more to this than, I think we kind of at that phase in life also. So all this came together, and we started with an initial idea of, can we use digital technology to help government? You saw the physical constraints that when you talked about. Government is the primary agency. They are.
And how exactly are you making that work along with Vinny in Punjab? I mean, maybe you could share a story of what you're doing with her.
Sure, a few things. So the first thing is we started talking. Vinny introduced us. We reached out to Vinny through Mali in Chennai. And she introduced us to her team, which is the Directorate of Governance Reforms. If that organization structure was not there, we wouldn't have had like a platform with which to make an impact, right? So this is an organization that's about like, simplifying government processes, taking government services to the citizenry, through electronic means and things like that. So we started off like, with the digital marketing strategy and like teams and trends, like, like that marketing was like, more traditional. So we kind of like brought in like, agencies, we brought in like a set of volunteers from the batch of 2020 who was just passed out, who researched and kind of like, did message structuring and stuff like that. And we had like work happening in Chennai and Bangalore in English and translated to Gurmukhi in Punjab. And like, it was kind of like, like to and fro. It was like, very interesting. We also identified list of influencers. The government is like, contacting them. Our work has started going out like through the Punjab CMO office now. Like, so it's essentially in the domain of awareness about like, COVID, myth busting, fake news and stuff like that. We also like got involved with that COA app. Like Punjab government is like, pretty leading, like, they kind of got out an app, like, as soon as like this whole thing came. Punjab is 50% of Punjab is on smartphones. They have this app has around 7 lakh downloads now. I think like they're trying to, mandate for more people to kind of download it. And it's got a whole variety of functionality. And we gave them some suggestions around, user experience, as well as like, we kind of like added some people to that team. All these are volunteer talent, right? This is pro bono because, the government is running at like warp speed. And like, the biggest challenge for us was to kind of like, get in pace with them to kind of like, get onboarded to any of these, right? Because they're working really, really fast. Third thing that we kind of did with Punjab is like, math modeling, right? We got like some people from the Chennai Mathematical Institute, actually that dean, and they had done some like, work in terms of, the R0, like in the spread of the disease, and like, like the publicly available data on Kaggle was kind of like, giving some very scary pictures, but some senior, administration officials from Punjab worked with like CMI to kind of like, evolve that model, apply it with real data and use it for predicting and like, cluster management and things like that. So that's another big thing. And we also rolled out bots, right, from UiPath. Like UiPath is one of our partners. Bots can help you. Like, this is a situation where you typically have sudden increase in demand for services, like, much higher than like, say, what e-commerce faces in Thanksgiving time, Black Friday, whatever, right? Like, so that can be done with bots.
Sorry, I'm just going to try and get some of the other questions because I'm conscious a little bit of time while you're doing this. And I think some of these questions may actually help you do this. And there's a great question from Nayanthara, which I'm going to save till the end because it's probably relevant for the other discussion as well. But Vinny, I think there's a couple of questions. Are you planning to do some kind of cluster testing? Is there a statistical way to identify potential groups without doing 100% testing? Is WHO playing any role? Dr. Soumya Swaminathan, who's the daughter of MS Swaminathan, the father of the Green Revolution. She's a deputy head. Are they helping you in any way? So I think there's a couple of questions around the signs of this, which,
Okay, so on testing, it's humanly impossible to test the whole population, right? And because it's not even as though it's like a pollution under control certificate. It's not valid for 3 months. You could be clean today, you could be affected tomorrow. And testing is expensive. But more than anything else, you need to have a strategy. You need to, what you're currently doing is public health measures to ensure that the people who have the virus or who are in contact with those in the virus do not end up spreading it to others. So you need to see who is symptomatic, check them quickly. So the testing is around the symptomatic currently. It's called the ILI or the SARI, the influenza-like illness or the severe acute respiratory illness is the first group of people that you target, and you try to test all of them. Then you test the contacts of positives. But for, I think you're talking about pool testing. There's been a lot of discussion around pool testing. Can you do 32 samples all together and test them together? There's been a lot of work done around that. We've also done that. In India, currently, the advice is to do not more than a sample of 5 for pool testing for getting accurate results, because you don't want to dilute so much that your results actually show false negatives. And we have, in fact, Punjab was the first state to actually work on pool testing, and we are currently doing that. But that's advised and done only for areas where the likelihood of having a positive case is low. So that's for various reasons.
Okay.
How WHO is helping? Well, we have a regional office, we have a country office. Soumya directly is. I've known Soumya since my health days. She's wonderful. It's great to have somebody like that as the face of WHO. But WHO gives broad advisories, and we are in touch with them at all levels. We've also got, like Venki, I'd really like to acknowledge the work that Venki and his colleagues have done. It's been just amazing. And all my colleagues are like, so I was like, is there anything you want me to request them to do? Ma'am, they're already doing so much. They're amazing. So that's the feedback from my team. And really, hats off, Venki, to you guys. But there have been others who have offered help. So there has been faculty from Johns Hopkins. We are in touch with them, the Center for Policy Research in India. And we are working together on trying to get the most scientific testing strategy in position very quickly so that before things flare up, we're able to use what is inevitably going to be a limited facility. We are crossing today 10,000 tests. But that's order of magnitude that you can do for a 30 million population, right?
Okay. So I'm just going to ask one last question to the two of you before I shift to the second story that we wanted to share. There's a couple of more general things about how do we sustain this later, which I'll say for the end for all the panelists. But Vinny and Venki, I mean, there's this thing about the Kerala government and their amazing response. Are there any learnings that social media, whatever it is, the way we use digital, the way they manage this whole thing, anything that you want to share, anything that you've been kind of learning from them that you think is kind of helped you, or you think is a great practice to follow?
I want to admit that all the years I was health secretary, I used to say, Kerala is not part of India. Kerala is part of Sri Lanka insofar as health indicators are concerned. They've always, for so many long years now, they've been right up there on health indicators and their health interventions. They have a very strong public health system. So I was very pleased when we ended up second in the country after Punjab ended up second after Kerala, and I said, we have done this. So Kerala has really done good work, and I think it's the outcome of years of building a very strong public health cadre, a very strong government system that has developed, that has generated confidence in the people, and they've been able to reach out to them. But I think we are less visible. Venki is helping us getting more visible. There is a visibility issue, but I think we are all on the same path, which is doing a lot of surveillance in the community, doing scientific testing, ramping up facilities so that you can isolate the positive cases. And remember, 80 to 85% of a COVID positive case will not require anything more than paracetamol to recover completely. It is only about 15% cases which suffer respiratory distress. Out of them, not more than 5%. So overall, about 2 to 3% of the positive cases are likely to need ventilatory support. Ventilatory support actually is the equivalent, as I think somebody pointed out, of Bhagwan ka plan low. So it's the probability of success is very low. So Kerala model is great, but almost all states in the country are following the same route, and I think not doing too badly.
Thanks a lot, Vinny and Venki. I'm getting at least 5-6 more questions. Some of them I think are relevant, and I'm going to ask Sanjeev to possibly talk to the High Commissioner and Ramraj at the end about them. But Vinny, Venki, thank you a lot. I think it's really fantastic, and we'll kind of save the real thank yous for the end of this. But I'm going to invite the second storytellers, Ganesh and Bala Ganesh from Bangalore and Bala from Chennai, to come on video and share their story of FeedMyCity and what they're doing with that. Bala, Ganesh, welcome to IIMChat. I don't see Bala on this. Is he on? There he is. Thank you. Thank you. That's a lovely logo you have behind you. Thank you, Ganesh and Bala, for joining this. I'm going to start with Ganesh, with you. You kind of, you suddenly had this idea that, that there are, I'm going to go beyond the theory and the gyan about the fact that migrant workers need food and all that, but you one day felt I needed to do something about it. So what was the trigger? What made you suddenly say, I'm going to go, not only bother about my startups and all of that, but go and do something? You're on mute, Ganesh.
Yeah, okay, yeah. So Yeah, thanks. Very happy to be here. Good morning, good afternoon, based on where you are. Okay. Thank you for having me here. So this is not anything that we had planned for or anything that I had in mind. Was into second, third day of lockdown, doing the usual stuff, beating the chest, forwarding messages, trying to figure out what's happening, that all of us do. But like all of us, in the heart, the desire to do was always there. It's there in all of us. It's just that opportunity not there. It was fortunate that one of my friends, Jaggi Mara, who is the managing director of JLL, he actually saw my interview the previous night on television on how corporates should do something and all that, completely unrelated to social initiative. He got triggered by it and immediately sent me a message at 11 p.m. at night saying that, buddy, can we do something? Right? So next day morning on 26th, we had a chat saying that the migrant laborer, daily wage worker who has lost their livelihood, but still had a family to feed, how are they going to support themselves and can we do something on it? So we quickly got on a third person, Venkat, who is CEO of Prestige Construction, listed entity in India. I have never met Venkat in my life. I've never spoken to him. I don't know him. So he got him on WhatsApp call and three of us were discussing, saying that, can we do something? He says, okay. We said, Bangalore will need to feed 3 lakh meals we need to feed. And typically it will require about 1 crore plus of rupees to be able to do that. Can we do that at scale? Can we do that while keeping the hygiene, keeping sanitization, keeping social distancing, all that in mind? And remember, this was the third day or fourth day of the lockdown starting. So still curfew passes had not been issued, daily passes had not been issued, the world was in turmoil, people were not allowing all of that stuff. We said, can we do it? Yes, we should be able to do it in Bangalore given the context that we have. That's how on 27th, we started by serving 500 meals to migrant daily wage laborer. It was tough because we had to talk to the DCP to get permissions, to get the vehicle passes, and the system had not even been started. We never expected it to go beyond Bangalore, beyond totally till lockdown, serving 3 lakh meals and a total budget of about 1 crore of rupees is what we had in mind. But fortunately, or unfortunately, whichever way you look at it, depending on the need that is there, it took a life of its own. When we started with this, we started getting incoming calls, inquiries from other cities. First to start off was Hyderabad, where a colleague of Jaggi with JLL Hyderabad said, I want to start this in Hyderabad. Can you help me start? Then we started sharing some of the practices that we have. This was on the fourth day of the whole idea being born. So can we start? They said, yeah. We started that way. Then I think the floodgates opened. Then like typical IIM guys who are on this panel and all this, we said, you know what? We can actually make a playbook out of this. Okay, let's create a MVP, a minimum viable product. If you are able to create a MVP, we can actually replicate it across. Then after 2 more days, the Noida authorities called up and said, listen, Noida is in a very bad shape with migrant laborer, daily wage laborer. As you all know, Noida, the land had been acquired by industries. So there were a lot of a combination of villagers and daily wage laborers who are serving as maids, as artisans, as this, who had no job. So that was thing. Then from Chennai, we got Gopal Srinivasan saw my tweet, and Gopal Srinivasan and Ramraj from Chennai reached out saying that, can we do this in Chennai? So then we started saying, you know what, we can actually do a playbook out of this. Some of it is centralized, some of it is local, get heavy hitter local leaders and have a full process map drawn out. I'm trying to use management jargon as much as possible given sensitivities of this particular crowd. But it has been extremely humbling, a great learning. We have now in 5 cities. We started, we have Mumbai, we have Noida, we have Chennai, we have Hyderabad in addition to Bangalore. All of it following a similar pattern. A lot of local variations because working with government, working with police, working with local challenges is very local. So I wouldn't say it's central, but great journey. Yesterday, we just completed serving 20 lakh meals. Okay, right. So that is a phenomenal achievement in across all cities, and each city is led by a great team of volunteer leaders who have selflessly stepped up. We have Balu and Ramraj here. We have people in Chennai. Venkat is there, and we have other people in Chennai and each of the cities working with us. I think extremely humbling and great learning experience. None of it I expected. Happy to share some of the challenges and this later date. Ballu.
So a question that I think it's a good thing for Balu. When you got this call, did you anticipate what is going to happen? Did you get this playbook and what actually happened? Can you tell us all the different calls and the things, the people that you had to work with the government to kind of make this possible? I mean,
the address to me or Ganesh?
Yes, to you, Balu.
Okay, all right. So, just rewinding, I think it was April 2nd or 3rd when I got a call from Ramraj and Gopal, and he had huddled with Ganesh, and we quickly put together a team of about 10 of us in the core committee and literally hit the ground running. Fortunately, Ganesh put us on to, he had already started this model. So Hunger Box was the identified, food supplier. And it will be of interest to a lot of people in Singapore to know that in Chennai, the primary kitchen that we use is that of Annalakshmi, which is a well-known brand even in Singapore and Kuala Lumpur and all that. So, one thing was the quality was taken care of. I think we have some of the, tastiest food being served to these migrant workers. And one way we ensure it is that every day, at least one or two of the core committee members get one packet of food delivered to ourselves. And we make sure that food is tasty and the quality is good. And the process itself actually ensures that after the food is prepared, it's packed in aluminum foiled packages. No hand touches them till the hand of the eater. So that's really hygiene at its highest standards. And one other thing that I should mention is that timeliness. We had set metrics for pretty much everything. 12 noon and 7 p.m. lunch and dinner has to be at the respective places. And we have so far met 100% delivery and 85% on time. And the 15% which is delayed is a maximum of half an hour. So instead of 12, it reaches at 12:30. Instead of 7, it reaches at 7:30. But by and large, so this whole thing has been possible due to actually, I would say, 3 or 4 networks coming together. One is at the highest level. We've had a team of entrepreneurs, IIM Alumni, Thai, the Chennai Angels, all of us, leveraging contacts. The second thing is Greater Chennai Corporation partnering with us. So we've actually become de facto the official partner in this exercise for Chennai Corporation too. So we deliver the first primary deliveries to 8 zones, but 15 zones of corporation are covered. 92 wards are covered in this. And about this is the third organization is the organization of volunteers. We have worked with an NGO with about 120 volunteers on the field who are really doing all the heavy lifting. And they work with the ward officers to make sure that all these migrant laborers are fed. So, taste, hygiene, quality, timeliness, these were covered. And the other thing is that, with respect to the nutrition value, we made sure, actually, we've been listening to the consumer also in some ways. Initially, we were serving, I think, 450 grams. Then we raised it to 550. Calorie value was calculated at 1,700 calories per meal. And then after 2 days, we started with 5,000 meals on the first day. But very quickly, corporation said, hey, guys, you guys are doing a great job. People love this food. We would like you to take up more territory. So quickly, it went to 10. And now today, 32,000 meals per day we are serving. And we crossed the 500,000 mark yesterday, 520,000 meals as on 25th of April. So it's a phenomenal achievement. And if you, go back. So one thing I was telling you was about listening. So some of the North Indian laborers wanted, hey guys, twice a day, rice, you're killing us. Can we have chapatis? So third day, I think 9th or 10th onwards, the dinner was, chapati, dal, chapati, kurma, chapati, aloo gobi, whatever. But excellent response by the kitchen and ramping up. Rotis are difficult, but really ramped up. And I think it's been a wonderful experience. So this is the execution side. But we've also been receiving 95% of the money we've raised is from just about 600 donors. People have been extremely generous. Entrepreneurs in Chennai, even rest of the country who have some emotional link to Chennai have been opening up their hearts and wallets. And we've had, sources of funds pouring in from all over the world. And I think, like other cities, Chennai and Chennaiites have risen to this challenge very well. And like Ganesh mentioned, it's very humbling, to see that, we are able to do our little part in this whole thing.
So I think I have a question, and I'd really leave it to you. I mean, Ganesh, maybe you want to answer this. I think the first question I have is, both of you are entrepreneurs, both of you are talking this, and it's wonderful to actually hear MVP and scaling and metrics and all of that in a social thing, because, in some ways it says we are bringing what we learned to a good cause. But my other question to you is, how much of this time of both of you is it taking? I mean, Ganesh, do you do anything else? I mean, because this sounds like a lot of effort that people are putting in. So what percentage of your time is going away from what you're doing in your work and this? And it's a genuine personal question, because, how are you guys managing your time?
No, it has taken a lot of time. From my perspective, we started it, like I said, the first conversation was on 26th, and I thought about this. The idea came from Jaggi. It has been it's 1 month now, and the entire month, I would say at least 16 to 18 hours a day has been on this initiative, because it is reducing now, but each city starting, logistics of the city, challenges of the city, fundraising for the city, and fundraising centrally, getting teams of volunteers. We have 120 volunteers across all the cities working on this. All of them are volunteers, all of them are full-time jobs. So to that extent, the number of hours is 16 to 18 hours a day for last 1 month. But what's more important is, this is not the toughest job. The toughest job is not for me. Okay, right? I'm on WhatsApp continuously and completely chasing up people, connecting people and all that. The real work is done by actual on-ground volunteers. Even now, I have gone every alternate day or once in 3 days, I go into the field, to the kitchen, to the thing. But there are people who are going there every day. And I can tell you, that is scary and tough. You're talking about slum areas, you're talking about actual distribution points, including some of them very close to containment zones. I think they are really the one which you should hats off. So one is the time. Your question is right, and I think I'm having it the easy way. Okay, right? Time in my confines of my home most of the time, because I have a 84-year-old mother and 80-year-old aunt. I've been advised not to go out. And other things carry is, I'm 58. They say you're almost on the verge of 60 in becoming a vulnerable population. I thank God that I'm 58, because if 2 years later, if this had happened, I don't think my family would have allowed me to go out saying that I need to be taken care of by other people. So that also brings a sense of mortality, urgency into what I'm doing. But this is the first social initiative I have. I've never done it before. Even though, as you know, in startup, you also run a startup. I have great experience of non-profits, not by design, because none of the companies make any money.
None of them make money. We don't know what making money is in startups.
So I have great experience of running non-profit businesses. Whether it's Tutor Vista to Big Basket to Potia Medical to Bluestone and all of that stuff. But great amount of learning in terms of this. I think that's hats off really to the people who are doing it.
So some questions are coming in from the audience, and I'm just going to ask this, right? So one, I think, is, can you talk about the funding and funding requirements if the lockdown is extended? And as you know, there's some things about it will get extended, it will get partially reduced, etc. There's another question about, what percentage of the hungry people do you reckon you're feeding? How big is that need? And there's a third one, which is also related, which basically talks about, 1 minute, I'm trying to find the question in this. It talks about the kind of, how can IIM Alumni help you scale this beyond 2 million meals? So I think, these are questions that are coming in about the whole initiative that you're on. And do you see this happening? I mean, I know we're saying somewhere in May it will go on, but as we saw in Singapore, they started off saying May 4th, it's become June 1. We don't know how long this will go on. So How many people are you feeding? What percentage is it? How big is the need? How can IIM Alumni help?
So to answer, I think all valid questions. Thanks for asking, Balu. With your permission, I'll just go
Sure.
with it first. I want to bring a national perspective and national this one, and not let Chennai take away the. I had time.
Go on, what's wrong?
Completely. So it's like this. What we are doing is a minuscule part, right? Really minuscule part. If you ask me, can I do more? Can I do more? 100% yes. What percentage? It's a single-digit fraction of the need that exists in each of the cities. We are not able to go anywhere near that. That constraints are a lot of it on our own constraints. Okay, right? One, Balu mentioned this. We wanted to ensure we are able to cook fresh meals hygienically with social distancing, not spread the virus, not create food poisoning. So it had to be top quality, scalable, large. This one of the biggest challenges this sector has had. We were not the first to start. A lot of NGOs have started, but very few people have been able to scale beyond 1,000 meals. Forget about 1 lakh meals a day. Not because they don't have the intent. They don't have the wherewithal, process, ability, money, volunteer strength are able to do. So there is actual dearth of it. So we are serving one. Two, we wanted to do this only till 14th during the phase 1.0 of the lockdown and stop maybe by 15th or 16th. We got extended till 3rd. Now we know definitely it's not going to end on 3rd. And all of you can imagine, even if it ends on 3rd officially, it's unlikely that on 4th, the migrant laborer or daily wage worker will start earning his livelihood. So it's not going to end. But anyway, officially we have been told that anyway it's not ending on 3rd, that it is going to get extended. Different state will have different levels of extension, but it's going to have. What is stopping us is one, money. That's donation. We never geared for this. We thought we'll end by 15th. So after that, all of us, including Ballu, Ramraj, Venkat, all of us had to go back to people and extend it for lockdown 2.0, which ends on 3rd. Now, definitely we are looking at lockdown 3.0. We need lots of money. In terms of scale and amount of money, I think we require another 10 crore money more to be able to serve even at the current phase till end of May. So that's a lot of money. We want to serve 30 lakh meals. 30 lakh meals is what we want to serve. We need more money to be able to do that. That's one.
And Ganesh, this is just in, there's another question that's coming, so I'm sorry to interrupt. So you're talking only about the 5 cities you are in today. But one of the questions that's coming is, if the playbook is available, and this is a really nice question, why not take this to more than 5 cities? Why not take it nationally?
Yeah, we wanted to take it nationally initially. After the 5 cities, we did look at cities like Calcutta, Pune, for example. We were not able to gear up enough strong volunteer force and conviction that we will be able to get a force to work with the government and local corporation. Without getting into politics or party and reasons for it, each one of them requires working with the local administration, local government, local corporations, which is a challenge. And obviously, as you can imagine, all of us are doing this centrally on WhatsApp without actually being able to move. So it is really our ability to get local strong volunteers. We are fortunate that the Chennai team of Gopal Srinivasan, of Ramraj, of Ballu and others reached out and was able to mobilize using TIE, Chennai and Chennai Angels and all of those. But that thing is lacking. It's not that we have not got requests, we got requests, but we have not been able to scale. Again, remember, unless we can do at large scale, it becomes a small hobby or local initiative, which we don't want to enter. So, and we had to implement social distancing. Other challenges, Hunger Box, which Ballu mentioned, which is just as a disclosure, is one of my growth story companies. They do corporate catering to IBM and TCS and top multinationals of the world. The food is cooked in the same kitchen that during normal times serves an IBM employee. Serves same process, same ingredients, same kitchens, same cook. Hunger Box is present only in 16 cities. They have actual capacity to be able to do this in 12 cities. It's not that there is nobody else is available, but if I go outside that, I will not be able to scale it without assuring that. So those literally are the challenges that we are facing. We wish we can help more. Even now, Chennai has done an excellent job. In Bangalore, when we started on day 1, we started only with 500. because we were scared how to implement it. Chennai started with 1,000 on
Ganesh, in the interest of time, I'm going to kind of this thing. So, because I think we have a few more minutes and I have a few more questions coming in on this one. And thanks, everybody. Keep the questions coming. We're also going to get, the High Commissioner, Ramraj, Sanjeev, talk about some of these things. But a couple of questions, maybe just, I think maybe Balu, you want to give me a short answer on this thing. So one is, are you working with other kitchens like, churches and gurdwaras? They do this all the time for the supply side. Another one, which is interesting probably for both of you, is do you see this lasting? Do you see FeedMyCity becoming a permanent initiative after COVID? Because obviously not just because of COVID, the problem doesn't go away. So any quick thoughts on those two?
So first one.
And then can you do a plug-in that the funding is covered under CSR and undisbursed funds can go towards your target? So I think these are some of the questions I'm getting. And again, a short answer.
In Chennai, we've actually augmented the Annalakshmi capacity with another well-known restaurant called Taligai. They have a fairly large thing. So we've done that. We've not gone beyond that at this point of time. So that's answer number one. Secondly, in terms of a time frame, we've been told to be prepared for 50% of the capacity beyond 3rd till about the 10th or so, and then 25% till about another week more, and then tapering down to 0. But the jury is out on that, and we'll have to see how that goes. Ganesh, you want to add anything?
Yeah, on CSR, yes, these funds are available, are applicable for CSR spent for Indian corporates. So people can spend out of CSR money. It has got ATG and 12A income tax exemption. So individual can get ATG and income tax exemption. So would definitely be.
Thank you. There are also a couple of things that are coming in from other people. Ganesh, Bala, one person who says, Rohit Raj, who's an alumni out here, who says that they are working already and serving meals and they'd like to connect with you. So we will do some of these connects afterwards. Again, in the interest of time, I'm going to wrap up. I'm just going to ask Vinny and Venki to come back on. There are a couple of questions that I'd like to ask all four of you before handing off to Sanjeev and Ramraj and the High Commissioner. So Vinny, Venki, I mean, again, I don't want to say, I think there are lots of questions that are coming about, which asking one thing that I want to ask all of you. Everyone is saying this is fantastic. How do you keep this going? Why does this happen only in a crisis? How do you keep this going? This whole spirit of speed, of collaboration, of doing this. How do you keep it going? So, I mean, any of the four of you can answer that. And I'm kind of lots of different questions have come around this idea. How can you motivate alumni to do something? How can you keep the spirit going?
So I'll jump in. So I think the crisis kind of crystallizes the opportunity. So to that extent, we've jumped in. Right now, we are looking at stabilizing it. We are looking at experiences all over the world. There are examples like Code for America, which has 4,000 volunteers today. Right, we are just like 30 volunteers right now. So it's about institutionalizing this. The learnings that we've learned from interacting with the government, we want to take it. We want to work with more alumni. We want more talent coming on board, and we want to take it to multiple governments. So that's my quick answer.
Yeah, I tend to think crises do make for stronger partnerships between government and the private sector. I think the first time I saw it in the global financial crisis, there is a lot more interest in these issues because you realize public good effects, you realize that there are matters that affect the whole community and also affect you. So it breaks cocoons a little bit. But I think it's also a trend that we are seeing where increasingly people are looking to give back. I mean, the number of people who are looking at early retirement and doing some sort of work for the community more directly, I think is a trend that we've been seeing. And this, I agree with Venki, it's basically crystallized this, but I think it's a trend.
Great. And okay. Bala, Ganesh, any thoughts on that?
So my personal view is that the opportunity always exists. I mean, the crisis has brought a lot of us together, but individually, I think the opportunity is there for everybody every day of the of your life. So it's just a question of looking beyond your daily obsessions like your business or work or operations and getting associated with some other activity. I've been a Rotarian for now 28 years, and I can tell you one thing. I'm part of one very, very active Rotary Club. We do a lot of work, and you have to take time for it. And I think there is that ability. I don't know, Feed My City initiative, obviously, as you know, just as the name describes, may not really go beyond this crisis, but each one of us has the ability to plug into something else that's going on around us and contribute. I think that is something we are solely responsible and answerable to ourselves on that, and it's up to the individual. So it's not like a crisis has to wake you up.
Ganesh?
Yeah, no, I think all of them covered it. All of us have the goodness in our heart. We want to do it. I'm sure all of us have done something or the other in our own small ways to be able to do it. But opportunity like this, which is once in a century pandemic, brings into forth the need to do it at scale. And I'm just glad that we've been able to use many of the things available at our disposal. Network, contacts, connects, platform, companies like Angerbox to be able to do it. Right now, not looking at anything beyond. My biggest this one is, how do we ensure that till the time the extended lockdown gets over, I'm able to fund, keep the volunteer motivation going, keep the process going, so that we are able to feed till the time some level of normalcy returns. After that, we'll see how to continue the social initiative.
Thank you. I think we're nearing the end of this. We'd actually asked people, because we anticipated we'd get a lot of questions, that we would have about an overrun of about 10 minutes or so. I am going to hand this off. I'm just going to quickly address a couple of the questions that came before I hand this off to Sanjeev. One is, there's a lot of questions about what happens after the trade-off between economics and livelihoods and lives. There's a couple of things about how businesses need to get back onto their feet, etc. So Sanjeev, maybe you want to address this along with Ramraj and the High Commissioner. There's also, I think, a question which I think is very relevant for you, which is, can you become part of a platform as IIM Alumni, which continues to contribute to these initiatives on an ongoing basis, and what do you want to do? But before I hand off, I think just one more thing. The KVN Foundation.org is the website to go to if you want to try and contribute towards the Feed My City. You can pick the city you want to and contribute money to that. kvnfoundation.org.
Suresh, kvnfoundation.com.
Sorry,
not KVN Foundation.
I thought it was non-profit. Sorry, my mistake.
No. So feedmychennai.org or feedmybangalore.org, but let's not confuse. kvnfoundation.com. You can go there. You can click on any city you want to contribute to or support. You will get the links there. Both international credit cards, domestic credit cards, all of that is available. Bank transfer, all of that. kvnfoundation.com. Sorry.
Thank you. And I think the other emails that many of you wanted to either be linked with Vinny or Venki or Pala or Ganesh or anybody else, or have ideas that you want to contribute, please write into secretary@iimpact.org. We will try and create some kind of a channel where we can make these link up happen. With that, I'm going to hand over to Sanjeev.
Sorry, there is secretary@iimpactglobal.org.
My apologies, guys. Bad moderation. Secretary@iimpactglobal.org. Thank you, Subra, for that correction. Sanjeev, over to you.
Thanks, Suresh. It was a fascinating discussion till now, so I'd like to thank all of the panelists, Ganesh, Ballu, Vinny, and Venki. Welcome, High Commissioner Jawed and Ramraj. So what we have now, we are in the wrap-up part of the session. So firstly, my question to the High Commissioner. So you're in a unique position, I guess, just like Vinny is, being an IIM alumnus as well as senior government official. So we've heard that specific example of private and the government partnership. And in fact, it was interesting to listen to Venki saying that they needed to run hard to keep pace with the government. So this is entrepreneurial bureaucracy, which in normal times would be considered an oxymoron. But anyway, the question to you is, how do we make this much more of a consistent model where the two sides, the private sector and the government, they work together, and not just because of a crisis? I guess that was a question earlier as well. So would like to get your perspective on this.
Sanjeev, other panelists, and those who have joined in, first of all, good afternoon from Singapore. It was a very fascinating discussion. I learned a great deal about what's going on both in Punjab and as well as through the FeedMyCity initiative. It's truly exemplary what's being done. Just to build on that, some of the thoughts that I had while listening to the discussion. One is that, this is really an unusual situation. So, one of the things in government, of course, is that there's sometimes competing and complex set of objectives which cloud sometimes the clarity of thought and purpose. I'm just putting it as diplomatically as possible in this context. Today, we are facing a single major crisis, and therefore everyone's attention and everyone's focus is on this particular problem. It really does, you will see always in moments of crisis that governments do tend to act in a very entrepreneurial manner with a great deal of speed. I see this, in fact, right after this, I'll be very brief because I have to get onto a video call on the logistics of moving PPE kits from different parts of the world to India. But one is that we've seen that it really depends a lot in some sense also on the way government looks at its own role and looks at the way it wants to work with the private sector. Second is, or the non-government sector. The second, of course, is that, you have to recognize that participating or doing something for society isn't either a government monopoly or a unique obligation that governments alone have. And just as we've seen the FeedMyCity initiative, and what we see here is four things. One, of course, it's successful because it brings a lot of capability, brings a lot of credibility. And you've seen the success comes from, the support, the systems, and the scale and the speed. And all of this really boils down to the kind of commitment and capability people are able to bring in. How do we leverage this on a consistent basis is a change in the attitude in the government to draw from this experience and see we can do this for a whole set of problems. We've done that to some extent in the digitalization program in India and in the Digital India and the India Stack initiatives. We have sometimes done it through history also in the context of dealing with some of our health issues in HIV case, for example, or in dealing with some of the hunger related issues in the past. But to make this on a more consistent basis, that's one, that attitude. And the second is that I think that if there are initiatives of the kind that we have seen where real professional capabilities come in, there will be also an interest in collaboration. I think in the last few years, I see that changing, a far more open attitude, both in the center and the states, that the monopoly of wisdom capability does not reside in the government and certainly not resources. And therefore, there is a need to work more with the other sectors. Skills development has been a classic example of where government has been consistently working with private sector, both through CSR and other initiatives. So an attitudinal change on both sides, and then to draw lessons on how do we build systems that leverage the capacities and governance models on both sides for a common good. The other thing is that we should identify a few key objectives that are most pressing for the government to work on. I mean, whether it is in the realm of livelihood or skills or health, we can choose a few initiatives and work on it, because if sometimes we have very diffused objectives or multiple objectives, then we come back to the same problem. So this is the other thing that we can work on. And leveraging technology, I mean, this is something which then young Indian professionals and some of the more experienced ones are being able to bring to the table. I mean, fortunately, I mean, that is one way we have been able to scale up many of the initiatives in relatively short time, is the use of technology as a platform. So I think there is reasons to be optimistic that this can work. But as I said, that to take this into a normal ordinary real life situation is not going to be very simple, because here you're dealing with one immediate crisis with timelines, with goals, etc. Many of our lives are on standstill as well. I mean, that's the other side of it. So to translate this, of course, again, as I said, we've got to work together and draw lessons. And I'm sure that there are enough people in the government who will be willing to listen and willing to experiment, as long as we have this kind of initiative that we are seeing now. And again, you know, we have always said we are not a manufacturing country. I cannot tell you how woefully short we were on the basic PPE equipment. But as Vinny was just mentioning, how quickly people have been able to ramp that up, both in terms of development and in productionization. So again, this is a classic area where we can set goals for ourselves, including in the long run on developing a R&D and manufacturing base in India. It would work well. So hopefully we draw some good lessons from it on both sides.
Thanks, High Commissioner. So Ramraj, turning to you, of course you've been intimate part of the initiatives, some of the initiatives that were described just now. But my question is more related to from an institute perspective, since you are on the board of IIMC and you do work with the other institutes closely as well. So the question really is, this particular session is a good example of cross-border collaboration across alumni. So my question to you is, what role do you think the institute wants to play or can play in further strengthening these kind of initiatives and engaging in a more consistent fashion with the alumni, so that these then become much more scalable, and your perspectives and messages to the Singapore-based alumni community as well?
So I think the key thing from an institute perspective is that we are going to have a mixed offline, online education system going forward. I don't think everybody is going to be comfortably on campus for the next 12 months. And so one request to all alumni is to share. IIMC has a collaboration partnership with Coursera. So any suggestions and ideas on your own experience on how best to carry on the high quality education that we provide to our students in this new environment. So thoughts around that would be welcome. So I'm reversing it and requesting help rather than sharing, because that is going to be a dire need of how best to teach in this environment. So any thoughts on that would be welcome. What otherwise I think the Institute has done is there has been an article that one of the faculty has written, which many of you may have seen. It is talking about an index for where economic contact index, he calls it, where there is no distancing, what happens there? Industries where distancing is difficult, how will you come back and create economic activity? It's a very interesting point of view and maybe worth reading.
Sure, thanks. One more quick question to you, then I'll come back to the High Commissioner. So when I look at the panelists and the profile, all of you are entrepreneurs, so you've been on the entrepreneurial journey for quite some time. Whereas most of the alumni that we have are in corporate lives and so on. So your message, so that the entrepreneurial spirit that should be there in most people, even though they are in corporate life, for them to get engaged in socially relevant initiatives like this.
Buy from startups. All companies, all corporate people, please buy from startups. I think we need orders to get them back on their feet. And that by itself, I think, would be one of the best helping hands that all of us can extend. And that spirit of helping by itself will get you closer to these entrepreneurs and get that same spirit of no dying, win, and therefore the spirit of winning. But I think the help that is needed is to buy from entrepreneurs, give them orders.
Thank you. So back to you, High Commissioner. So you've been, in terms of raising the profile of professional Indian diaspora in Singapore, you've been instrumental in that and bringing various different segments together. And to let you know, in the spirit of inclusiveness, this IIMChat too has been extended to all the different segments, not just in Singapore, but in India as well. So given that context and your passion to leverage the professional Indian diaspora here, I'd like to hear your perspectives on and the messages to the community here in terms of how to engage in socially relevant causes in a scalable way, both to contribute back to the country that we are living in, which is Singapore, as well as back to where we came from, which is India.
Thanks, Jeev. Let me first just focus on the immediate challenges that we have. And I think the problem of this pandemic. Now, in Singapore, of course, there are numerous ways in which I think people can get involved. Let me say that the most obvious thing, even in Singapore, particularly now for the workers in the dormitories, many of whom are getting laid off and face an uncertain future. You know, a lot of, although the Singapore government has been providing meals, there's obviously, there's always a gap, and particularly with respect to the kind of food that is provided. And there are a number of organizations that are providing Indian meals to Bangladeshi and Indian foreign workers who make up majority of those who live in the dormitories. So there is that aspect that we can work on because this is going to last for a while, this lockdown. The second is that many, in fact, about 400 to 500 workers are already laid off. Now, the promise to provide funds or salaries does not apply to them because, you know, the way the government works is to get the employers to pay the salaries and the government subsidizes it. But in case where the companies are folding up, there is a problem. So Singapore government, in fact, was also asking us if there's some way in which we could support some of those while they are still here and are unable to go back or find employment, and which also they said if there are some ways in which we can help in re-employing some of those foreign workers who are laid off. A very interesting initiative by Lisha, for example, the Little India Shoppers and Heritage Association. They're providing meals for the fasting Muslim workers, particularly from Bangladesh, both for the to start the fast and the sehri, and then for the iftar. But I think, you know, in many ways, people are also contributing through technology. Thanks to you, Sanjeev, that we were able to connect on this platform called No, which some of the DOMs are using. I had passed this on to Minister Ishwaran. Again, you know, Anil Ahuja, who's my batchmate from IIM, he is working with Sinda to support them with his online education platform, 88 Tuition. And then now we've connected him to Mendaki so that he can reach out to the Malay kids as well. But as we were discussing, I mean, in some ways we can also see they're now living in the lockdown condition, the foreign workers. It's literally like, if I may say so, being in an experience of being in a prison without, of course, you know, because they can't go out. Most of them are now confined to their rooms, 8 to 10. So in some ways, can we help develop content that, that is both enables them to connect with their lives back home, their families. Of course, government has provided now Wi-Fi to them so that they can download this content. Something in terms of learning experiences as well, or some kind of new skills that might be helpful for them, or even games and stuff, because, you know, they're spending 8 to 10 hours the entire day sort of inside. So to maintain a sense of a positive attitude would be helpful. I think most of them are from Tamil Nadu, and if they can, we've been talking to MOM if the workers would like to speak to some people and, you know, generally as a way of both counseling and as well as career counseling, etc. That would be helpful. We've got also a large number of Indians who are stranded here, and it takes, an entire range of them. There are tourists who came here. There are people who are government. Embassy, of course, is taking care of their accommodation. They're taking care of food and even medical help wherever that is needed. But there are large number of students who came from very poor background, not just those who study in NUS and NTU, etc. There are Coleman College, Beacon College, people who really work their way through education. They come from relatively poor backgrounds, often from rural areas. And most of them are in very difficult situation. So we're trying to help them. And if some of the professional organizations and Indian associations can also step in, some of them may just be requiring, which we are doing, providing food and accommodation. But if others would like to contribute to it, we can network that. But we've created a nice platform for all that. Also, some of them, we could put you in touch with in terms of their career counseling or in some sort of a confidence building conversations, because they're feeling very uncertain about their future. Many feel that they will not be able to continue here, and so on and so forth. There are some students we've actually connected to counselors because they're feeling lonely, they're feeling depressed. They've come from India, and including in elite universities like Yale and US, etc. So that's the third. But I think that, in a more broader sense, as we move forward, I think as a professional community here, there's a lot we can do to contribute generally to society over here. One, of course, is, in skilling and reskilling, because going forward, there's going to be, this is a big disruption even for the Singaporean economy. And a lot of this is going to be disruptive for even people who are at the low end of jobs, etc. So I think that's one thing that Sanjeev and I have been often talking about, is in terms of skilling, reskilling, mentoring. Many of us here are developing startups and innovation platforms. And to the extent possible, we can work with communities here to find solutions for elderly, to find ways of connecting families with the caregivers. And that would be really, really helpful. And again, very specifically, organizations, there are many organizations that are working, for example, community centers. We can work with Sinda and Mendaki and other community organizations in areas that enable people who are feeling a sense of uncertainty about their livelihood because of skills, because of employment opportunities, etc. To find ways in which we can help them. I think we are uniquely positioned, both in terms of our capacities and skills, but also in our entrepreneurial spirit today in Singapore. So that's one way. And the other is that, yes, do take time off on weekends, etc., to try and connect with community organizations and help them in a variety of ways. They're very, very innovative ways in which they're working together. So these are some of the thoughts for the immediate and for the future.
Thank you. So I'd like to, on those things, High Commissioner, the EXCO colleagues of mine, and we'll work with you as well as together with other professional organizations to see how we can follow up on some of the specific requirements that you just now stated. So I'd like to thank you and Ramraj for joining me in this conversation. So overall, it's been a fascinating session today where we've heard examples of how people with IIM management education background have managed to bring rigor and consistency to the way they've gone about making a difference to the society. So we heard terms like MVP and metrics and so on being used in the context of these kind of initiatives, which generally people may say it, but they pay lip service to it. But here there are real examples of how things are taken from one model and scaled to other cities, and being passionate about quality, timeliness, and so on and so forth. We, of course, have examples of two people here from bureaucracy, Vinny and Jawed here, who are making a difference. And Vinny, it really is lovely to see how the entire government machinery can transform itself, I guess that's the way I'll put it, to come up to speed, and in fact, where the private sector is gasping for breath. So really refreshing to see that. So with all that, my message to the community that has participated in this, I'd like to thank them as well for joining in this. The important thing here is, while many of us can dip into our pockets and contribute money, which is important, of course, but the more important thing probably that can make a scalable difference is to give our time to these. So with our professional experience, expertise, and the networks that we have, if we can commit a certain amount of our time, we can make a substantial difference. And this is, to begin with, this crisis is not something that's going to go away in a short term. But more importantly, this probably is making us more aware of the kind of transformations needed. And some of them may be just socially oriented, but many of those are fundamental. Suresh already gave the contact details. You can write to secretary or president at iimpactglobal.org. Most of you have my personal contacts as well. So once again, thanks to everyone. This has been
Sanjeev, there's a 15-second poll.
Sorry, just once again. Let me just finish.
Right, there's a 15-second poll. It's just two simple questions that will take people literally 5 seconds, which Subra is going to flash up. And I think it just requests people to press on it if they can, before I know you have a closing message as well.
Yeah, so I was just going to get to that. So basically, this is the first attempt that we have made in taking IIMChat to the virtual world. So we'd love to hear your feedback on that, which some of it will be covered in the poll questions. But if we haven't covered those, please feel free to give us the feedback. So with that, thanks once again, and Subra, over to you to commence the poll.
Well, the poll will come up, and it's a very simple thing. It's just simple 2 clicks that we'd like you to do, and click on. It will help us, I think, understand a little bit better what to do. Sanjeev, would you like to perhaps, for the people who are, most of the people still are on the call, would you like to talk about the next session that you're planning?
Yes. So while you're pondering on how to respond to these questions, I'm pleased to let you know that High Commissioner Jawed has agreed to an IIMChat session with him exclusively. So that is going to take place 2 Sundays from now, which is 10th of May, I think. And the timing will be the same, 11:30. So thank you, Javed, for that.
Thank you. I look forward to being there.
So looking forward to all of the people who registered for this. We'll keep this momentum of IIMChats going, and looking forward to much more collaboration as well. So Suresh.
Thank you very much to the panelists, Venki, Vinny, Balag, Ganesh. Thank you so much for sharing your stories. We are inspired by it. And I hope that at least, from the poll results where most people strongly agreed with this, that at least 80 people out of us will get off to using WhatsApp for what we normally use and use WhatsApp the way you guys have been using it. So thank you very much for providing that inspiration. Thank you, High Commissioner. As always, I think you've been a wonderful presence for that. So, and thank you all, and look forward to seeing you 2 Sundays from now.
And Singapore should also contribute to the FeedMyCity initiative from here.
Yep. Thank you, High Commissioner, for that.
Thank you.
Thank you all.
Thank you.